We know as we get older, our vision changes. We hold papers a little bit further away to read or invest in cheater glasses to make reading them easier. But there are other more serious issues that can arise as we age. Dr. Douglas Rhee has joined us in the UH broadcast studio to open our eyes to these ailments. Dr. Rhee is an internationally recognized glaucoma surgeon and the chair of ophthalmology at University Hospital's Eye Institute. So welcome to our show.
Thank you very much for having me.
So we're going to talk briefly, actually we're going to look briefly at some eye issues. Let's start with glaucoma. What is that?
Sure. So glaucoma is a condition in which the pressure inside the eye is too high for the optic nerve to withstand. And if it's uncontrolled, then you can permanently lose vision and it can make you blind. It's much more common as we get older, but it can affect all age groups. As we get older, over the age of 60 per se, it affects roughly about 3 to 5% of individuals of European ancestry. Of persons of African or Latino ancestry, you multiply that number by about 1.5 to 2.0.
Oh,
so
boy.
it's actually highly prevalent in the demographic of golden opportunities.
Okay, wow, all right. So that's why you get that little poof in your eye when you go to the eye doctor?
Yeah, so that's the old way of checking pressure, and some people still do that, but it's certainly something we all remember as we were kids, that air puff of test. But now what you'll see, the way we measure pressure is there's actually something that comes very close. It's the blue light, and it gently touches the front of your eye, and it measures the pressure. It sounds like it's going to
Sounds awful.
Sounds like it's going to be uncomfortable, but it's not. We numb your eye, and it's such a gentle touch that theoretically you could even do it without anesthesia, but we still give it to you. It's just such a gentle touch, but it's very important and provides us a wealth of information, both diagnostically as well as we monitor for treatment.
So what's the treatment?
So the treatment for glaucoma is to lower the eye pressure. We have multiple modalities in which we do that. We use drops, we can use laser, we can use incisional surgery. For the individual person, we will sometimes not always follow the same algorithm, but in general we do eye drops first, and then usually we move on to laser and then to incisional surgery. However, there could be specifics to an individual's case or severity in which we might need to skip to one right away.
Okay. Macular degeneration is also something that can cause blindness. So talk a little bit about that.
Sure. Macular degeneration is the leading cause of blindness in the United States. What it does is there's an aging degeneration that causes loss of vision in the very center of the vision. So the periphery is largely left intact, but the center is gone. And with the center being gone, then if I were to look at you, your face would be missing, and that would be a shame because it would be hard to recognize you. It means that you have trouble reading or watching television. And so a lot of the joys that we have as we're getting older is to see your kids grow up, your grandkids grow up, and reading and television. Those become extraordinarily challenging with macular degeneration. It's much more common, again, as we get older. It's more common in persons of European ancestry, but it can affect persons of any ethnicity. We do have some treatments for it. There's two different forms. There's the dry form and the wet form. For the dry form, our treatments are more at delaying the progression, but there's a lot of research going on to see if we can intervene and maybe even restore vision. They're actually for the wet form of macular degeneration, which used to be considered the more aggressive form and the worst prognosis. We actually do have treatments that can help improve vision. Those do involve injections into the eye, and I know that sounds even worse.
Yeah.
Sounds even worse than checking the pressure, but if you speak to people who have had it, who undergo the injections on a monthly basis, it actually hurts less than getting an immunization shot in your arm. So it's actually very well tolerated, and it also has a side benefit of actually improving the vision, so people are pretty motivated to have it.
Yeah, I would bet.
Yeah, yeah.
Wow, I wish we could talk more about eye issues.
Sure.
We'll have to have you come back another time.
Absolutely.
Your vision is essential to maintaining your normal daily life, so follow Dr. Rhee's advice and be sure to have an annual eye exam. Look for these things. Early detection of any kind of issues like this could help save your sight. My thanks to Dr. Rhee for joining us today.
Thank you for having me.
For more information, call University Hospital's Eye Institute at 216-844 3601 or log on to www.uhhospitals.org.